Together we don't stand. There is power in our union. Now the lessons of the past were all learned with workers' blood. Mistakes on.
Hello everyone, my name is Elizabeth Manns and I'd like to welcome you to the April 4th Coalition Show. This is the August 21st, 2023 edition of the show. It is the 467th show that we have done since the closing of the North Adams Regional Hospital and the 7th one that we have done since the announcement of its possible reopening by BHS. The April 4th Coalition's mission statement is, we are for workers' rights and collective bargaining rights and are against tax breaks for the rich and corporations who ship our jobs overseas. We support all the articles of the Universal Declaration of Human Rights, but as is our custom, we put the emphasis on Article 23.
And I'll do 1 and 2.
Okay, I have 3 and you have 4.
I'll do 4, yeah. Break my heart.
Everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and protection against unemployment. Number 2, everyone, without any discrimination, has the right to equal pay for equal work.
Number 3, everyone who works has the right to just and favorable remuneration, ensuring for himself or herself and his or her family an existence worthy of human dignity and supplemented, if necessary, by other means of social protection.
And number 4, everyone has the right to form and join trade unions for protection of his or her interests.
And as is our custom, we do a thank you and a shout out to Michael Putnam, who is the program director for the community radio station WMNB LP 107.1 for airing the audio portion of this show on Fridays at 6 p.m. and to the wonderful staff here at Northern Berkshire Community Television Corporation, Joanne Hurlbut, Nicole Brown, and David Fabiano for all their wonderful assistance helping us produce this show. And Dick, we're still Northern Berkshire County suffered a loss of one of its leading
Right. I figured
citizens.
the topic that we're covering today is health care, and it would be only appropriate that we remember that Charles Chip Joffrey Helper of Williamstown, Mass. passed away on August 16, 2023 after a long illness. And Chip, you know, was a real advocate for health care for everyone in Berkshire County. He ran the EcuCare. He started the EcuCare group, and they helped people get insurance if they didn't have any. Chip served the people of North Berkshire County as a clinical social worker, during which time he received several awards. And later he served as the executive director of the nonprofit EcuCare in North Adams. He also was an expert, establishing himself as the go-to person in health policy, bringing him opportunities to impact policy at the state level. He served as president of the board of directors for Healthcare for All in Boston and served on the inaugural Health Connector board during the implementation of universal health care in Massachusetts under Governor Mitt Romney. So it was a great loss to our community, and Chip will be missed.
Definitely
So,
will be.
to continue on the topic of health care, we advocate for a single payer system, Medicare for all. We're advocating for the state to pass its Medicare for all bill. But
Right,
Bernie
because
Sanders,
we don't have Medicare for all yet, do we? We have
No.
universal health care coverage, but it's like an
it's
HMO network.
just like Obamacare. It was
Obama.
preliminary to Obamacare. We try to get everyone on board, but not everybody is covered. But with single payer, everybody would be in, nobody would be out. And it would take the private insurance companies out of the picture. There would be still private doctors and private hospitals, but there would be one payer to pay those bills. So let's listen to what Bernie Sanders just recently posted, this speech about the healthcare crisis in America. There's crisis all over the world, and we can't get overwhelmed by them. We just have to continue working one step by step.
To get them.
Yes. So
get-
let's listen to Bernie and hear what he has to say.
Thank you very much for joining me. In the midst of climate change and all of the incredible devastation it is causing in our country and around the world, In the midst of unprecedented income and wealth inequality and a growing gap between the very rich and everyone else, in the midst of a corrupt political system dominated by billionaire campaign contributors who believe they have the right to buy and sell politicians, in the midst of right-wing efforts to undermine our democracy, and so many other issues, there is one major issue that I hope does not get lost in the shuffle, an issue that we have got to continue to concentrate on because it is life and death for so many Americans. And that is that almost everyone in our country understands that our healthcare system is broken, it is dysfunctional, and it is getting worse. A rational healthcare system is one that guarantees healthcare to all people as a human right. Our system is designed to make as much money as possible for the insurance companies and the drug companies. And that is the fundamental reality of our system. And the result is that today we spend almost twice as much per capita on healthcare as any other nation. Nearly $13,000 for every man, woman, and child in this country. Really quite incredible. And we spend an unsustainable 18.3% of our gross domestic product. Yet, despite all of that spending, we remain the only major country in the world not to guarantee health care to all, leaving 85 million Americans uninsured or underinsured. And as many of you know, that number has gone up recently as millions of our people have lost the Medicaid coverage that was provided to them during the pandemic. Despite our huge healthcare expenditures, again, almost twice as much as any other country on earth, our life expectancy, how long we live, is considerably lower than almost any other wealthy nation. And in many parts of our country, life expectancy is actually getting lower because of opioid addiction, because of suicide, because of inadequate health care and everything else. And incredibly, the gap in longevity, how long we live, between the rich and the poor in our country is now at least 10 years, as tens of thousands of Americans die every year because they can't access the health care that they need. In America today, we pay by far the highest prices in the world for prescription drugs, while the pharmaceutical industry reaps huge profits and pays their CEOs exorbitant compensation packages. 1 out of 4 Americans cannot afford the prescriptions their doctors write. Further, one of the major causes of the escalating cost of hospital care and insurance premiums is that many of the new drugs coming onto the market for cancer and for other diseases now cost over $200,000 a treatment. You got that? $200,000 a treatment. And as bad as our overall healthcare system is, and it is quite bad, our primary care system is even worse. Today, we have a major shortage of doctors, nurses, mental health providers, dentists, and pharmacists. And those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. As a result, tens of millions of Americans in every part of this country, even those with decent insurance, cannot find the medical care they need in a timely basis. Some Americans have to wait months to get a medical appointment. Others have to travel long distances to find the kind of doctor they need. According to the most recent estimates, Over the next decade, our country faces a shortage of over 120,000 doctors, including a very significant shortage in primary care physicians. The nursing shortage may be even worse. Over the next 2 years alone, it is estimated that we will need between 200,000 and 450,000 more nurses. We also have a major shortage of 100,000 dentists in America. And despite the very serious mental health crisis we are facing, there is a massive shortage of mental health service providers, and that is psychiatrists, psychologists, social workers, counselors, addiction specialists, and many more. Further, our home healthcare workforce is also totally inadequate. Now, here is something that's really interesting and kind of explains why we end up spending so much on healthcare. Most countries spend between 10 to 15% of their healthcare budgets on primary healthcare. Canada spends 13%, Germany spends 15%, Spain spends 17%, and Australia spends 18%. We spend less than 7%. In other words, we spend less than half of what other countries spend on primary health care. So it happens that instead of investing in disease prevention, in keeping people well, and enabling people to gain easy and timely access to the medical care they need when they need it, what do? We kind of ignore those issues, and then we spend very heavily on hospital and tertiary care, and we force people with very common illnesses to go into emergency rooms because they have no other alternative, at a time when emergency rooms are by far the most expensive form of primary care. The result is that every major medical organization in the country, no matter how conservative they may be, understands that what we are investing in primary health care is woefully inadequate. They understand that focusing on disease prevention and providing Americans with a medical home will not only save lives and ease suffering, it will save billions and billions of dollars. Providing primary care to all is not only smart health care, it is cost-effective health care. As chairman of the U.S. Senate Health, Education, Labor, and Pensions Committee, called HELP, I am working hard on bipartisan legislation that will begin to address some of the healthcare crises we face. Not all, but some. Legislation that I'm working on, if passed, would be an important step forward toward a more humane and rational and cost-effective healthcare system. And this is what that legislation contains, among other things. Working with the Senate Finance Committee, we would significantly increase the number of doctors in our country by greatly expanding the graduate medical education program, residency program. We would also expand the Teaching Health Center graduate medical education program and the National Health Service Corps. The goal of all of those programs is not only to increase the number of doctors we have, but to focus on primary health care and placing physicians into medically underserved areas. We would also provide incentives to those medical schools that are focusing on graduating primary care physicians. So the goal here is, yes, we need to increase the number of doctors we have, but we need to focus on making sure that those doctors are primary care physicians, general practitioners, people out in the communities, and also that those doctors go to the areas we need them most. And that is often underserved rural areas and urban areas as well. Furthermore, we would greatly increase the number of nurses that we need by expanding programs that address the shortage of nurse educators. And let me mention something to you that is really quite incredible and really speaks to the dysfunctionality of the current system. Unbelievably, in the midst of a massive shortage of nurses, the American Association of Colleges of Nursing tells us that U.S. nursing schools turned away over 91,000 qualified applicants in 2021. So here we have a major nursing shortage. Hospitals are spending a whole lot of money on what they call traveling nurses. Patients are not getting the care they need, and yet nursing schools are turning away qualified applicants. Why is that? Because they lack a sufficient number of faculty, and they also have inadequate physical infrastructure in order to train their nurses. So it's not complicated. If you have more faculty, nursing schools will be able to expand. That's for 2-year nursing schools, 4-year nursing schools, and that is what we have got to do. We're going to increase the number of faculty and the physical infrastructure of nursing schools. Further, our legislation would expand primary care by growing the number of federally qualified community health centers, FQHCs, that now provide primary health care to some 30 million Americans. You may not know it, but there is a community health center probably not far away from where you live. And the beauty of these community health centers, significantly funded by federal money, is that not only do they provide primary health care, they also provide low-cost prescription drugs as well as dental care, and dental care is a major crisis in this country, as well as mental health care, something that in many parts of this country we are in desperate need of. So this bill would increase the number of these community health centers throughout the country, concentrating on rural and urban areas which are now medically underserved. The result, if we can get this legislation passed, is that millions more Americans would be able to receive the primary health care, and that means dental care, means mental health counseling, means lower cost prescription drugs. They will be able to get that care in a timely and cost-effective way. Now, I don't have to tell any of you that year after year, politicians have been talking about our healthcare crises. Well, the time is now to end the talk. The time is now to act. Let's do it. Thanks very much.
All right, riding with Biden.
It's right up there with Biden, yep.
Yeah, right with
And we
Biden.
actually do have a community health thing here in Berkshire County because I'm in that practice and stuff. They don't have a doctor there, they have
Yeah.
nurse practitioners, but they're associated with Adams.
Right, in Article
Practice.
21 of the Universal Declaration of Human Rights, it says everyone has the right to equal access to public services in his country. So 85 million people, he said, are uninsured or underinsured. So that, we're not doing that. We need to do it.
We definitely need to do it.
And 1 out of 4 people can't afford a prescription that the doctor ordered. That's not right. You know, equal access to public services. We need to provide for that. Now, I think Bernie did a great job explaining it.
He did.
Is it okay to move to an advertisement I saw on TV?
Certainly, because we know
talking
this,
about-
this
talking-
topic is near
it's
and dear
talking
to your
about
heart,
equal
Dick.
access. So let's listen to this advertisement that was on the paper, and I mean on the TV this weekend, I saw it.
I first heard of Southwestern Vermont Medical Center about 6 years ago when I was an employee of Bennington College. My coworkers were speaking about their experience there, specifically within the OB/GYN department, so I decided to look into it and ended up making the switch to those physicians, and I've been there ever since. My first impression was the staff. They were incredibly welcoming. They were nice and helpful, and then obviously the nurses were the same way. My first experience with the physician there was Dr. Small, so I could not have asked for a better, more comforting, nurturing, welcoming physician. And she was so positive and really put me at ease. The birth of my first daughter, Iris, was a whirlwind. The nurses just instilled so much confidence in me, though, so it made me feel very comfortable, even though it was one of the scarier moments of my life, giving birth. I was unaware of what to expect, but they obviously were in control, so that made me feel confident in my ability, and they made us feel comfortable with where we were. The postpartum care was tremendous, and we could not have had a better experience. With our second daughter, Sloan, the pregnancy could not have been any more opposite, not in terms of my experience within the hospital system, just with my health and the baby's health. Sloan measured in the less than 10th percentile our entire pregnancy, so I was on high risk and she was high risk. The doctors and the staff and the nurses all did their best to make sure that we weren't, unnecessarily worried, and were pretty encouraging of us. All in all, it ended up being okay, and she was born perfectly healthy. Thinking about my experience both times, the nurses were empowering, just comes to mind, because they just made me feel like I could do it. Dr. Small is compassionate, nurturing, maternal, encouraging, instills just confidence in her patients. The last office visit I had, they did a stress test where they discovered that my amniotic fluid was quite low. So she gave me a couple options, told me, take your time, go home, speak with your husband, let us know, what we can do to help, make your decision. And I said, who's on call tomorrow? And she said, I am. And I said, okay, I'm gonna do this. I just felt comfortable with her. She knew the situation. She made me feel like she knew my story. She wanted to help. She knew exactly what was happening. And I just felt like that would have been the best scenario for us. And it absolutely was. She was very busy that weekend. I just think the level of care and the quality of the physicians and the staff and the nurses is just unmatched.
That's a very powerful message, and they recognize the fact that Berkshire Health System said they were not going to
Give
put
us
a maternity ward back in North Adams. We haven't had one since the closing in 2014, and it was one of the best.
So this is their pitch for you to come to them.
This is their pitch to go to them, and it's probably why we're getting a hospital, because of the competition that Southern Vermont is providing to Berkshire Health Systems. Now, just to, that equal access to care, they responded and said that, there's not enough babies born in Berkshire County for us to have a maternity ward here in North Adams. But it just so happens they have one in Pittsfield, and in South County we have an advertisement for the birthing center that they have in Great Barrington. Let's hear what they have to say in Great Barrington about their birthing center.
Too bad we couldn't get somebody to get it done.
It would be nice.
Hello, my name is Joan Pisano, and I'm the director of the Family Birthplace at Fairview Hospital. We ask everyone who comes into the hospital to please use their mask when coming onto the unit. So let's take our tour. I'd like to introduce Jamie Lafrenia. She is our staff nurse and one of our lactation consultants, and she will continue on with the tour for you.
So here at Fairview, we are a baby-friendly hospital, and during this time of COVID, we are doing everything we can to keep mom and baby together at all times and to keep them safe. And we ourselves are not going to any other part of the hospital. So I'm going to take you into one of our labor rooms so that you can have a look at our environment. So this is one of our labor rooms. You will be hooked up to the fetal monitor so that we can assess the baby and your contraction pattern. This is one of our labor beds. After delivery, you stay right in your room. We have pull-out chairs for dad that make into a bed. So dad or your care partner can stay with you the entire time that you are here with the baby. This is our infant warmer. We have the warmer set up for each delivery for emergencies, and we use them only if need be. We have the ability to suction the baby or to use oxygen should the baby need any. This is our nursery. We do not use our nursery other than emergencies, sick babies, or circumcisions. Here in the nursery, we have one of our isolettes. We take this isolette to the operating room for C-sections, and the baby was transported back to the unit in this isolette. During this time with COVID so prevalent, we have done everything we can to give you the same kind and loving care that we have always offered. We here at Fairview Maternity look forward to meeting you and your new addition to your family.
I think it's kind of unfair to judge Fairview because this was done during COVID.
But they've been running it even
even
more
now,
recently, that same one.
I think they should update it. a
They
little
did.
bit.
That was the first one I got, but there was another one.
Good.
Almost exactly the same, and it was put on a month ago. So,
The flaw with the approach is to focus on the equipment rather than on how they're actually going to help you through the birthing process.
but the-
Whereas Southwest had a person who actually went through it, talk about it,
Yeah.
and endorse
Right.
rather than this.
And they also said they provide a baby-friendly hospital. So does that mean we won't have a baby-friendly hospital here in North County with our hospital, even
At
though
this
they're
point,
both are
right now, no. If you don't have maternity wards, you can't
Right.
have a baby-friendly hospital.
You know, we're just asking for equal access, but we'll work to
Oh,
we'll work to start a birthing center if we can do that.
Mm-hmm.
And we'll have to choose which hospital the birthing center will work with,
Mm-hmm.
Southern Vermont or Berkshire Health Systems. You know, but that'll be up.
That'll be up to the birthing center people,
Yeah,
right?
it'd be up to the midwives and the doulas and the nurses that open up the birthing center. But, you know, they might choose to go the Southern Vermont way.
They might.
Yeah, but, you know, we're advocating for the mothers and children in
Of
North
Northern
County.
County.
Of North County.
Give us at least something, you know what I mean, once in a while. And sometimes you really, you gotta remember.
Sometimes do something because it's right for the citizens rather than for the money.
Yes.
I mean, you know, your BHS is not suffering at this point. They're going to invest a lot. I understand it can't be right away, but there's no reason in the future that they couldn't look at it again.
Right.
and
Again,
say so.
everyone has the right to equal access to public services in his or her country.
Oh, yeah.
But you see, we don't consider medical public service in this country.
It should.
It's a business. In this country, it's a business. It's not.
Well, it's the same business. They're running all three hospitals. They should provide the same,
They should provide the same, but they probably don't want
especially
to.
because the distances are so large. And in pregnancy, that's an important,
Issue, it's one of them, yes.
you know.
The more you know. We were going to ask how many babies were born
Oh, I
before
haven't
they
got a
to the
chance.
hospital.
Yeah, I haven't had a chance, but I will visit the ambulance service and find out how many babies they've delivered. We've
That
heard
would
from
be
the
good to
mayor's
know.
office that the police have delivered several.
And guess what? We're running out of time, so we're going to say thank you for watching and
Power
power
to the people. Power to the people.
Power to the people, that's right.
That's right.
We got
There you
power
go.
right here.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power in our union. Now the lessons of the past were all learned with workers' blood. Mistakes of the bosses we must pay for. From the cities and the farmlands to trenches